everyone, this is Sharifa Usman from Respiratory. We've asked from our professor, from our Miss Annalyn Mansan, to demonstrate how to do the auscultation for the anterior and posterior auscultation. So in this video, I'm going to demonstrate to you on how to do the right auscultations. Just a short review of the chest auscultations. Respiratory system and interpreting the lung sounds. It is a fundamental component of physical examination that can assist the diagnosis of respiratory system and identification of abnormal or adventitious noises. When auscultating lung sound, ask the patient to breathe in, breathe out in each auscultation point. Start above the clavicle to measure the apex of each lungs. Then the middle lobe in the right lung and the upper lobe of the left lung. And we're finished by auscultating the lower lobe of each lung. Is the anterior chest auscultation. For the posterior chest auscultation, start at the first intercostal space of the posterior chest, moving downwards, avoiding the scapula to the 7th intercostal space.